you mind if we take pictures of you doing this?
No pictures, please, no.
Too late.
Sure, I don't care.
I can remember.
Of course. And this should be in your book, but probably not well diagrammed.
Okay.
Okay. And so Tim's just going to take that back, and we're going to get a little bit fatter, kind of as we go. Maybe a little bit. And I'm bringing it a little bit closer to you because we're going to get longer with. There you go. Now, just like when you're cutting surgery as a resident, cutting sutures as a resident, remember they're always too short or too long. So no matter how you do this, it's always too short or too long. I have learned to err towards making this a little bit longer. Even a little bit longer, yeah. Have you built one of these, Tim?
What's this called again?
I call it a cocoon wrap, but you can call it a continuous loop, or just some people just call it. I don't like it when people call it a rope stretcher, because a rope stretcher in my mind is something like you see in Freedom of the Hills, which is a macrame rope stretcher, which is fine, but not good for spinal immobilization.
Better for a hammock.
Better for a hammock, yeah. Okay. Just do one more your way. Okay, now we're going
Notice
to...
the perfection with which our student Tim has his loops gradually widening into the mouth.
You can run like that. Okay, that'll be perfect. So here's a tarp, and this isn't a very big tarp. A bigger tarp would be even better, but we don't have it today. Now, Tim, can you get down there? So one thing is, remember we were talking about the C-collar, and I said people always want to be pretty. So people always want to be pretty with tarps too. So making this pretty, we would go just like this. There, that's so pretty. But the problem with making a tarp pretty is a couple things. Number one is, assuming it's snowing out, or raining out. So when Tim and I go to fold up the patient now, where's the snow and the rain going to end up?
On their face.
Right into the system, especially if it's fat and we can barely close it and there's gaps. Okay, so much better is for Tim and I not to be pretty and to just move the whole thing this way. And so that when we put it over the patient, as you'll see in a moment, and in theory this part is up, there's no entry point for precipitation. So that's a good thing. Okay, number two is sometimes you end up with these really wimpy tarps. One time I was teaching a course and I used one of these and I got this tarp, I think at Kmart or something, and I was so psyched because it was like $2. And then when I opened it up I realized it was basically for Barbie dolls. And but you don't have to make this thing flat. You can use the hypotenuse. So turn this so it's diamond shaped. And you see how suddenly that got way longer? So even with a little tiny tarp that's basically, let's say, Scott, that's 6 feet tall, we could turn it like this, and it would be plenty long for Scott. It wouldn't be as pretty. And then the last thing is, if we're doing this in cold weather, we want to create what's sometimes referred to as a hypothermia wrap or a burrito wrap. People make a big deal out of it. It really isn't anything other than just taking the foot part, cheating towards the feet, folding it over Scott's feet like this, and then folding the whole thing over. So he's sort of burrito wrapped in him. So we'll go over this again because we're about to do it. Okay.
One of the things, Howard, may I just add something? If you're going to do it off-center, it's best to off-center it on the side of the patient's injuries, because you want their injuries on the open side so you can maybe even get your hands in and palpate pulses or something like that, versus the closed end, because then you pretty much have to unwrap them to get to the injured side. If they have bilateral injuries, then you have to do whatever you have to do.
See, that's interesting in a nurse and a doctor. The doctor just puts the system on and wants everybody to notice how great it looks, and the nurse actually thinks about taking care of the patient.